Hi, I'm Dr. Tess Mauricio. I'm a dermatologist and aesthetic surgeon and founder of M Beauty Clinics in San Diego and Beverly Hills. I've been in practice now as an aesthetic dermatologist for about 20 years, and how I got into the regenerative medicine space is because I do liposculpture in my practice, and I had access to fat, and I actually was one of the doctors that introduced platelet-rich plasma in combination therapies with energy-based devices. And so I really was a huge passionate believer in the power of utilizing our own regenerative products like platelet-rich plasma, and then fat and nanofat was amazing to incorporate in all of those combination therapies. How I talk to patients about the use of nanofat and regenerative therapies is that, you can use filler for volumization. Obviously, as a dermatologist, we have patients who come into us and asking to reverse the signs of aging, and of course, volume loss is a huge issue, and skin deterioration as well. And the advantage of utilizing nanofat is that, one, we can revolumize and we can use a lot of volume. So we are almost not limited by quantity and cost. And then of course, the regenerative powers of nanofat is unlimited in my books. And that, there's definitely studies that show, and we see this in practice all the time, that not only are patients getting volumization, but they're getting an amazing rejuvenation of their skin. It looks younger. It has a glow that is youthful. And we also use nanofat in combination with energy-based treatments for the rejuvenation of the skin. And we can do that all together on the same day. So I was one of the first physicians that introduced combination therapies utilizing regenerative products like platelet-rich plasma and energy-based devices like lasers, microneedling, radiofrequency microneedling. And so in my practice, we use them all together in combination, which really gives the patients the very best results. So it's not uncommon in my practice that I will harvest fat, we'll do the fat transfer, and then we will work on the patient's skin utilizing lasers, radiofrequency microneedling, and then introduce nanofat on the surface of the skin and microneedle it. And what we find is that we get less downtime and optimized results. Having a practice in Southern California, I have a very diverse patient population. And so it really helps to customize the treatment plan for patients. But what the regenerative products do is I feel like we are getting less potential complications, including less post-inflammatory hyperpigmentation when we introduce energy-based treatments on skin of color. And so both platelet-rich plasma and nanofat is used on the surface of the skin after energy-based treatments, and what we find is an incredible response as far as reversing the aging of the skin, but more importantly in skin of color is we are reducing potential complications. When I perform a fat transfer procedure for volumization, we utilize two kinds of fat. One is microfat, and this is what we think of as more of a structural revolumizing fat. So if patients have lost a lot of volume in their cheeks, jawline, around the mouth, the chin, that is where I would use microfat. And then in areas where we want finer, more subtle, also more finessing, that's where I would use nanofat. Nanofat is such a beautiful, consistent, homogeneous, wonderful, malleable product that I love to use to really target fine lines around the mouth. We use it for the under eye area. We also use it if patients have acne scars. We also inject it under areas of discoloration and sun damage, even melasma. So the combination of the use of microfat and nanofat is really beautiful and really takes your results to the next level.